of painkiller, and if you are concerned, seek medical advice. That's how we treat a headache.
A heart attack happens when the supply of blood to the heart muscle is suddenly blocked, usually by a blood clot. Lots of people make a full recovery, but there's a serious risk that the heart might stop beating, called a cardiac arrest. It's vital that you help someone who's having a heart attack and call 999 or 112 for emergency help straight away. People who suffer from angina are at increased risk of having a heart attack. Angina is chest pain, often described as a heaviness or a squeezing pain in the chest. The pain should ease within a few minutes if the person rests straight away and takes their angina medication. If the pain does not settle, it is safer to presume it's a heart attack. If you think someone is having a heart attack, they may show some of the following signs. Pain in the chest, which could spread to the jaw, neck, or arms. Breathlessness. Discomfort in the stomach similar to severe indigestion. Collapsing without warning. They may suddenly feel faint or dizzy. They may experience a feeling of impending doom. Pale skin with blueness at the lips. They may have a rapid, weak, or irregular pulse, sweating, or be gasping for air. If you do come across someone with these symptoms, call 999 or 112 immediately and say you think they're having a heart attack. After you've made the call, help move them into a comfortable position to help ease the strain on the heart. The best type of position is sitting on the floor with their head and shoulders supported and their knees bent. Place cushions behind them and under their knees. Then, if you can, and if they're not allergic, give them an aspirin tablet, 300 mg, and tell them to chew it slowly. Aspirin should not be given to someone under the age of 16. If they have angina medication, you can help them to take it. Encourage them to rest. While you wait for help to arrive, monitor their breathing, pulse, and level of response. Try to stay calm to avoid unnecessary stress. If they become more responsive at any time, open the airway, check their breathing, and prepare to treat an unresponsive casualty. You may need to do CPR. So remember, if you think someone is having a heart attack, call 999 or 112 immediately, help move them into a comfortable position, and encourage them to rest. Give them 300 mg of aspirin to chew and help them with their angina medication if they have some. While you wait for help, keep checking their breathing, pulse, and level of response. And that's how we help someone who may be having a heart attack. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/.
To bandage somebody's hand, use a roller bandage. Place the bandage on the inside of the wrist, just below the thumb. Wrap the bandage straight around the wrist twice. Then wrap the bandage from the inside of their wrist diagonally across the back of their hand up to the nail of their little finger, straight across underneath the fingers, and diagonally back across the back of their hand to the outside of their wrist. Pass the bandage under their wrist and repeat, diagonal over the back of the hand, across the fingers, and back again. Keep going the same way, bandaging diagonally across the hand like a figure of 8. But each time, only cover about 2/3 of the previous layer. Each new layer should be covering 1/3 of new skin. Make sure you leave the tips of their fingers peeking through. Once you've covered the whole of the hand, wrap the bandage straight around the wrist a couple of times and secure with a pin or tape. To check the circulation, squeeze the fingernail for 5 seconds. When you let go, if the colour doesn't come back within 2 seconds, it means the bandage is too tight and you need to loosen it a little bit. Keep checking the circulation every 10 minutes. So remember, when applying a hand bandage, use a roller bandage. Make sure the bandage extends far beyond the injury site to ensure an even pressure is applied to the wound. If someone sprained an ankle, knee or elbow, you can use a bandage to support the limb. To make sure you give the right kind of support, bend the joint slightly and apply an ice pack and padding, and then a bandage to help cool and support the injury. You need to wrap it either side of the injury too, to give enough support for the whole area. We're going to demonstrate this technique on an ankle, but you could use it for an elbow or a knee. To bandage an ankle, use a roller bandage. Make sure you have the ankle raised and supported to start with, and then apply an ice pack and some padding. Using the roller bandage, start with the tail and put it to the inside of the foot, and then wrap it around 1.5 times just to make sure that it doesn't come off. I'm just going to lift up your leg a little bit. Okay. It's important to bandage from the toes to the knee because you need to make sure that you cover from the joint before to the joint after the injury site, and then just keep on going around and around. So keep on going until you get to the knee. And then if you can, wrap the bandage around twice when you get to the knee, and then just pin it in place. Does that feel okay? Yep. To check circulation, squeeze the toenail for 5 seconds. When you let go, the colour should return within 2 seconds. If it doesn't, it means the bandage is too tight and you need to loosen it off and reapply it. Keep checking the circulation every 10 minutes because the ankle may still swell. So remember, when you're bandaging a sprain, apply an ice pack and then cover the injury with padding. Apply a roller bandage to hold the ice pack and padding in place and to help support the injury. Check circulation every 10 minutes and keep the injury elevated. And that's how we bandage a sprain.
If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call for help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting their head back with 1 hand on the forehead and 2 fingers under the chin. Pick out any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this. To do chest compressions, kneel down by the child beside their chest. Place only 1 hand on the center of the chest. Lean over the child with your arms straight and press down vertically 1/3 of its depth. Release the pressure, allowing the chest to come back up without removing your hand from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute, This is quite fast. And to help you, you can sing Nelly the Elephant, which can help you to keep up with the pace. After 30 chest compressions, open the airway and give them a further 2 rescue breaths. Continue to alternate between 30 chest compressions and 2 rescue breaths until help arrives. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get a telephone, take the child with you if you are able. Do not leave the child to look for an AED. The emergency services will bring one with them. If there is someone there who can help, if they have brought an AED, ask them to turn it on and follow instructions while you continue CPR. If they can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruptions to chest compressions. Continue CPR until emergency help arrives and takes over. The child starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally again, put them in the recovery position. So remember, if you come across a child that's unresponsive and not breathing normally, call for help. Tell a helper to call 999 or 112 straight away and ask them to bring an AED. Give 5 initial rescue breaths, then 30 chest compressions followed by 2 rescue breaths. Continue giving 30 chest compressions to 2 rescue breaths until help arrives or the child starts to breathe. And that's how we perform CPR on a child. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Sunburn is caused by overexposure to the sun, a sun lamp, or overexposure to radioactivity, although this is extremely rare. We can avoid overexposure by covering the skin with clothing and wearing sun cream. If you think somebody may have been sunburnt, there are 3 things to look for: reddening of the skin, pain in the area that's been burnt, and blisters. Encourage them to take sips of cold water. Cool the area down by sponging them with cool water, or soak the sore skin in a bath or a shower for no longer than 10 minutes. You can repeat this if it helps ease the pain. If the burn doesn't blister, then the sunburn is mild and you can treat with calamine lotion or after sun to soothe the sore skin. If there are blisters or other skin damage, then the burn is severe and they will need to see a doctor. You will also need to look out for symptoms of heat stroke and heat exhaustion, as these can be life-threatening. Remember, cover the skin, take sips of cold water, cool the skin. If there's no blistering, then use calamine lotion or after sun. If there is blistering, seek medical advice. And that's how we treat somebody who's suffering from sunburn.
Dehydration occurs when the amount of fluids lost from the body is not adequately replaced. It is mainly the result of excessive sweating through sporting activity, hot temperature or fever, but can be caused by diarrhea and vomiting. There are 4 signs of dehydration to look for: headaches and lightheadedness, dry mouth, eyes and lips, small amounts of dark urine, muscle cramps. If someone is dehydrated, help them to sit down and give them plenty of water to drink. Giving them an oral rehydration solution to drink will help replace the salt and other minerals which they've lost. You can buy rehydration sachets from the pharmacy. If they have any painful cramps, encourage them to rest and then help them stretch and massage the muscles that hurt. Keep checking how they're feeling. If they still feel unwell once they're rehydrated, then encourage them to see a doctor straight away. So remember, when you're treating dehydration, help them to sit down, give them water, give them an oral rehydration solution, encourage them to see a doctor if it doesn't go away. And that's how we treat dehydration.
If after performing the primary survey You find someone who is unresponsive and not breathing normally, call for help. Ask someone to call 999 or 112 and ask them to bring an AED if one is available while you begin CPR immediately. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR as soon as possible. You will need to start with chest compressions. Kneel down beside the casualty's chest. Place one hand center on the chest and place the heel of your other hand on top and interlock your fingers to lift them off the ribs. Lean over the casualty with your arms straight and press down on the chest to 5 to 6 centimeters. Release the pressure. Allow the chest to come back up without removing your hands from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast. To help you keep pace, you can sing "Staying Alive." After 30 chest compressions, you need to give rescue breaths. If you have not been trained or unwilling or unable to give rescue breaths, continue with chest compressions only until help arrives or the casualty becomes responsive. To give rescue breaths, make sure the airway is open by tilting the head back with one hand on the forehead and 2 fingers under the chin. Pinch the soft part of the nose and allow their mouth to fall open. Take a deep breath and seal your mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. Their chest should rise. Remove your mouth from theirs and watch their chest fall. Give them 2 rescue breaths like this. Continue to alternate 30 chest compressions and 2 rescue breaths. If someone can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruption to chest compressions. If there is someone there who can help, if they have brought you an AED, ask them to turn it on and follow the instructions while you continue CPR. Continue CPR until emergency help arrives and takes over. The casualty starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally, again, place them in the recovery position, monitor them, and prepare to start CPR again if necessary. So remember, if you come across an adult who is unresponsive and not breathing normally, call for help. Ask the caller to call 999 or 112 for emergency help and ask them to bring an AED. If you're on your own, make the call yourself, ideally by using a mobile on speakerphone so that you can begin CPR. Give 30 chest compressions, followed by 2 rescue breaths. Continue giving 30 compressions and 2 rescue breaths until help arrives or they become responsive. If an AED is available,